Information in this video will provide you with a better understanding of the Birmingham Hip Resurfacing System. The implant, the technique, and the benefits of each will be explained, as will the important guidelines for postoperative care and compliance. The long-term goal of hip resurfacing is to provide pain relief, restore normal activities of daily living, and enhance your overall quality of life. As you may know, the Birmingham Hip Resurfacing technique is an exciting new alternative to total hip replacement now available in the United States. Used successfully for years around the globe, this hip resurfacing technique was recently approved by the Food and Drug Administration for use in the United States. Now, patients suffering from hip pain due to arthritis, dysplasia, or avascular necrosis can benefit from its conservative approach to treatment. Because this technologically advanced surgical procedure resurfaces rather than replaces the end of your femur or thigh bone, you may participate in more physical activity with an implant that is potentially more stable and longer lasting than traditional total hip replacements. In fact, a 1,626 hip study of the effectiveness of the technique found that 99.5% of patients responded they were pleased or extremely pleased with the results of their Birmingham hip resurfacing surgery. Hip resurfacing is intended for young, active adults who are under 60 years of age and who are in need of a hip replacement. Adults over 60 who are living active lifestyles may also be considered for this procedure. However, this can only be determined by your physician with a review of your bone quality. There are certain causes of hip arthritis that result in extreme deformity of either the head of the femur or the acetabulum, or hip socket. In these cases, patients are usually not candidates for hip resurfacing. If you still have unanswered questions after viewing this video, please sit down with your physician, who will be happy to go into further detail regarding the Birmingham Hip Resurfacing System. You can also further research the procedure and the implant technology your surgeon uses at www.birminghamhipresurfacing.com. The hip joint functions as one of the most important joints in the human body. Designed for both mobility and stability, the hip allows the entire lower extremity to move in 3 planes of motion, while providing an important shock absorption function to the torso and lower body. The hip is a ball and socket joint made of the femoral head and the acetabulum, which unite the femur or thigh bone with the pelvis. As a result of this configuration, the leg can move forward and backward, side to side, and rotates left and right. There are 4 conditions that may lead to your doctor prescribing hip resurfacing: osteoarthritis, rheumatoid arthritis, hip dysplasia, and avascular necrosis of the hip. Arthritis affects 1 in 6 Americans and is the leading cause of disability. The most common form of arthritis is osteoarthritis. It is usually referred to as wear and tear or degenerative arthritis and occurs most commonly in patients over age 50, but can occur at any age, especially if the joint has been previously damaged by injury. As a result of cartilage degeneration due to osteoarthritis, joints lose both flexibility and strength, and often bone spurs develop on the joint's bearing surfaces. If the condition is allowed to worsen, you may experience pain at all times, even during non-weight-bearing activities. This has obvious negative effects on your lifestyle, perhaps needlessly so. Unlike osteoarthritis, which is a wear and tear phenomenon, rheumatoid arthritis is a chronic inflammatory disease that results in joint pain, stiffness, and swelling. The disease process leads to severe and at times rapid deterioration of multiple joints, resulting in severe pain and loss of function. Hip dysplasia is a lifelong condition shared by 1 in 1,000 people. Because hip dysplasia patients are born with an altered hip anatomy, the joint doesn't develop normal wear patterns over the years. This leads to wear and tear arthritis at a relatively early age. Avascular necrosis of the hip, often called AVN, results when poor blood circulation starves the bones that form the hip joint. In time, the starved bone dies and the hip joint collapses. AVN is most prevalent in younger or middle-aged adults. Alcoholism and corticosteroids are by far the leading causes of AVN. In rarer cases, AVN can result from a blockage in blood vessels from sickle cell anemia or fat particles, or from dislocation of the hip due to trauma. Hip resurfacing may be a successful option for alleviating the pain that accompanies degenerative hips, but it is not the only option. Before considering surgery, you may want to discuss these non-surgical therapies with your doctor. An appropriate weight reduction program may be beneficial for decreasing force across the joints. However, this can be difficult for people with arthritis since the pain precludes them from increasing their activity and burning calories. Your doctor can prescribe specifically designed exercises to improve strength and flexibility without increasing your pain. Various medications such as non-steroidal anti-inflammatory drugs and nutritional supplements may be used to decrease swelling in the joint and provide temporary pain relief. Assistive devices such as canes and crutches may reduce the force transmitted to the joints during weight-bearing activities and thereby may help decrease your pain. These are just a few of the options to consider before committing to hip resurfacing surgery. Although many of these solutions may help to temporarily alleviate the pain, they may not give you long-term relief and the opportunity to return to daily activities. If non-surgical treatment is unsuccessful, you and your surgeon may want to begin the discussion about hip resurfacing. The Birmingham Hip Resurfacing implant is not brand new. It has been in use around the world since 1997 and has since been implanted more than 65,000 times. It is new to the United States, however, where it was recently approved by the Food and Drug Administration for use in the United States. The benefits to patients of the Birmingham Hip Resurfacing technique and implant are clear. The implant's head size, its bearing surfaces, and its bone-sparing technique make it a preferred choice for young, active patients. While the implant's rate of survivorship is comparable to standard total hip replacements after 5 years, these 3 key advantages set the resurfacing technique and implant apart from its total hip replacement counterparts. The most noticeable aspect of this implant is its size. While it closely matches the size of your natural femoral head, it is substantially larger than the femoral head of the total hip replacement. This increased size translates to greater stability in your new joint, and it decreases the chance of dislocation of your implant after surgery. Dislocation is a leading cause of implant failure in total hip replacement. While total hip implants dislocate at a rate of 1 to 3% over the lifetime of the implant, a study of 2,385 Birmingham hip resurfacing patients found that dislocation occurred in only 0.3% of cases 5 years after surgery. Birmingham Hip Resurfacing takes advantage of one of the orthopedic medical industry's most technologically advanced bearing surfaces. That means that the surfaces of the ball and the socket are made from materials that dramatically reduce joint wear when compared to traditional hip implant materials. In this case, both the ball and socket are made from tough, smooth cobalt chrome metal. Traditionally, only the ball is made from cobalt chrome, and the socket is lined with a plastic cup. While this plastic cup has some design advantages, it does wear out over the course of many years since it rubs against the metal ball at a rate of nearly 2 million footsteps per year in physically active adults. When both surfaces of a hip implant are made from cobalt chrome, wear particles are reduced by 97%, thus potentially extending the life of the implant. There may be risks associated with metal-on-metal hip implants, though. While no evidence has been established on the subject, some are concerned that the increased level of metal ions found in the blood of metal-on-metal hip recipients may have negative effects on the human body. For this reason, some surgeons may not implant such a device in a patient with kidney disease or in women who are or may become pregnant.